Hello, everyone. Welcome to another session of Retina Roundup articles for August 2025. I'm Dr. Harshita, and I'll be taking you through the most interesting articles for this month. To start with, the first article was to study the efficacy and safety of intravenous prostaglandin E1 in the management of retinal artery occlusion, which was a systematic review conducted by Serhan H.A. et al. To evaluate the efficacy and safety of PG1 for the management of central or branch retinal artery occlusion. They conducted a Wilcoxon signed rank test to assess the effect of PGE1 on the visual acuity of included subjects. The visual acuity change was used as a measure to assess the degree of visual acuity improvement. They included a total of 6 studies with a total of 21 cases with ages ranging between 45 to 97 years. CRAO cases were about 85%, whereas BRAO cases were about 15% of the total. The median time from symptoms onset to treatment initiation was 7 hours. The median for initial dose was 40 microgram. Significant improvement in visual acuity after intravenous PGE1. The test revealed significant improvement in the visual acuity after the IV infusion. To conclude, the study revealed a preliminary evidence suggesting that IV prostaglandin E1 may be a potentially safe and effective treatment for improving visual acuity in patients with CRAO and BRAO. Moving on to the second study, it was conducted by Steen, Kirshner, Megan et al. To study the outcomes of descent membrane epiretinal graft for refractory macular hole closure. They reported the visual and anatomic outcomes of descent membrane epiretinal graft for refractory full thickness macular holes. It was an interventional case series including patients with refractory macular holes who previously underwent standard pars plana vitrectomy with ILM peeling for repair of macular hole with no success. Donor corneas unsuitable for keratoplasty were included and stained with blue dye, punched to obtain a 2 mm decimate membrane graft, which was positioned over the macular hole. At the end of surgery, 20% SF6 gas tamponade was used. The results showed 12 eyes of 12 patients with a mean follow-up of 8 months. The macular hole closure rate was about 91.7% and best corrected visual acuity significantly improved. The ELM and ellipsoid zone recovery rates were 33 and 41% respectively. To conclude, decimate membrane epiretinal graft leads to satisfactory anatomical and visual outcomes for eyes with refractory macular hole. Moving on to the third article by Feng Limiao et al., which studied the endothelial cell loss after pars plana vitrectomy with silicone oil tamponade. It was a comparative study of rhegmatogenous and tractional retinal detachments, forcing on differences between the both. They did a retrospective analysis on 427 eyes from patients with RRD in 293 and TRD in 134 who underwent pars plana vitrectomy with silicone oil tamponade. Endothelial cell density changes were recorded, and the impact of factors such as age, gender, surgical technique, oil emulsification, tamponade duration, and post-op IOP were evaluated. The results showed that the TRD patients had a significantly higher endothelial cell loss compared to the ones with RRD, particularly severe in patients undergoing combined anterior and posterior segment surgeries. Multivariate regression revealed a 1% increase in endothelial cell density loss for every 8-year increase in age. To conclude, patients with TRD are at a greater risk of endothelial cell loss after pars plana vitrectomy with silicone oil tamponade, particularly in cases involving combined surgeries. Advanced age and the absence of a natural lens were associated with a greater endothelial cell loss. Maintaining post-op IOP below 40 is considered safe for endothelial cell density. Moving on to the fourth article by Goldberg R.A. et al. This was to study the resolution of angiographic macular leakage with faricimab versus aflibercept in patients with diabetic macular edema in Yosemite-Rhine trial. The purpose was to evaluate if dual angiopoietin 2 VEGF-A inhibition with faricimab resulted in greater macular leakage resolution versus aflibercept in patients in diabetic macular edema. It was a post-hoc analysis of macular leakage assessment pre-specified in the Yosemite-Rhine phase 3 trials. Patients were randomized 1:1:1 to faricimab 6 mg every 8 weeks, faricimab 6 mg according to a personalized treat and extend based regimen, or aflibercept 2 mg every 8 weeks. The analysis included the first 16 weeks wherein head-to-head dosing was done and all patients received assigned study drug delivery every 4 weeks. Patients were assessed 4 weeks after receiving 4 doses of assigned study drug. The main outcome measure was macular leakage area on fluorescein angiography and the proportion of patients with resolution of macular leakage. The results showed that baseline median macular leakage area was similar between faricimab and aflibercept arms. At 16 weeks, median macular leakage area was 3.6 mm with faricimab versus 7.6 mm with aflibercept. More faricimab treated patients achieved a resolution of macular leakage versus the aflibercept at week 16. To conclude, faricimab demonstrated greater macular leakage resolution versus aflibercept during head-to-head dosing. These findings suggest that dual angiopoietin-2 VEGF inhibition promotes vascular stability beyond VEGF inhibition alone, supporting faricimab's potential to offer a greater disease control and extend the durability of patients with DME. The next article by Khananani AM et al. Studied continuous ranibizumab via port delivery system versus monthly ranibizumab for treatment of diabetic macular edema. This was the Pagoda randomized control trial, wherein they evaluated the efficacy and safety through 64 weeks of ranibizumab 100 mg per ml via port delivery system with refill exchanges every 24 weeks in patients with DME versus intravitreal injections of ranibizumab 0.5 mg every 4 weeks. It was a phase 3 multi-center non-inferiority randomized controlled trial conducted across 87 sites in US. Treatment-naive patients more than 18 years old with center-involving DME were included. The participants were randomized 3:2 to receive 4 monthly doses of ranibizumab 0.5 mg followed by ranibizumab 100 mg per ml via the PDS or monthly ranibizumab. The primary endpoint was change in BCVA from baseline averaged over week 60 and 64. The results showed that in a total of 634 participants who were randomized, the mean age was about 60. The mean BCVA change from baseline averaged over week 60 and 64 was an increase of 9.6 letter for the port delivery system and 9.4 letters for monthly ranibizumab. Mean BCA was similar to monthly ranibizumab 16 weeks after implantation. In conclusion, the trial found that the changes in BCVA from baseline averaged over week 60 by 64 in the port delivery system were comparable to the monthly ranibizumab group. Continuous ranibizumab 100 mg per ml via the PDS was approved in US for patients with DME in February 2025 and provides effective, durable, and generally well-tolerated treatment for DME with retreatment every 6 months through at least 64 weeks. The last article by Osdek S. et al. Described a surgical technique utilizing an autologous Tenon's capsule graft in 4 cases of complex retinal detachment associated with infantile high myopic macular holes, morning glory syndrome, and an optic disc pit maculopathy. The Tenon's capsule was exposed following conjunctival incision, separated from the episcleral tissue, and excised to appropriate size. The Tenon's graft were then inserted through a sclerotomy and positioned over the macular hole in 2 eyes, and the excavation of morning glory disc in 1 eye and implanted over the optic disc pit in 1 eye under a small PFCL bubble. Silicone oil tamponade was used in all cases. The results showed all cases achieved successful retinal detachment and demonstrated stable integration of the Tenon's capsule over a follow-up of more than 6 months with no signs of infection or inflammation. Oil was removed in macular hole cases and the grafts remained stable. In conclusion, Tenon's capsule transplantation emerges as a promising alternative sealing material in pediatric vitreoretinal surgery, offering potential advantages in terms of availability, stability, and efficacy. Thank you, everyone.